I've got a bad backache. It's kind of quite dull and intense. It's a bit different to my normal sciatica pain. It's more dull.
Today we're exploring back pain. Now I know the vast majority of cases are usually just non-specific musculoskeletal cases. However, in a small minority, the diagnosis can be very serious. My name is Dr. Ali, a doctor in the UK's National Health Service. Watch me take a history and see if you can get the diagnosis correct. Just to give you a clue, this condition is time critical and a delay in treatment can be life-changing. It's also one of the leading causes of medical litigation in the UK. Stand clear. Good afternoon, my name's Dr. Ali, I'm one of the doctors here. Can I first start off by confirming your full name and date of birth, please?
Yes, it's Marcus Gunn, 24th of August 1951.
Can I call you Marcus or Mr. Gunn?
Marcus is fine.
Marcus. And how can I help you today?
I've got a bad backache. Well, I'm hoping you'll give me some painkillers for my back. I usually take paracetamol and ibuprofen because I have had sciatica, but they don't seem to be working anymore.
Okay, I'm sorry to hear that you're in pain. Can you tell me a bit more about the back pain? Where is it exactly? Can you...
Yeah, well, it's kind of lower
Lower
back, yes.
Okay, lower back. And you said how long has it been there for?
A couple of days.
2 days, okay, yeah. 2 days. Tell me a bit more about the nature of the pain. How does it feel?
Well, it's kind of quite dull and intense. It's a bit different to my normal sciatica pain, just more dull.
More dull. Does it come and go or is it constant?
It's there all the time.
And what makes it better?
Nothing really.
So the paracetamol, ibuprofen is not helping you?
No, they don't seem to be working anymore.
Okay. What makes it worse? Does movement make it worse?
Nothing makes it worse or better. It was worse today than it was yesterday.
Oh, really? Okay. Is there a difference between the night and the day? Does it?
No, it's kind of there all the time.
Okay. And does the pain move anywhere at all?
Yeah, it moves down both legs, right down to the ankle.
Okay, so both ankles.
Both ankles.
Both
yes.
ankles.
Yeah.
Okay, and is that unusual for you?
Yeah, sciatica normally is just like one leg down to the ankle, but this is both.
Both. Okay. And do you have any stiffness in your joints at all?
No.
Okay. Do you remember injuring your back or carrying something heavy at all?
No, last few days I've just been sort of watching telly, well, I'm doing a bit of cooking, but nothing heavy.
And how severe is this pain? Is it keeping you up at night?
Yeah. My wife's complaining that I'm sort of tossing and turning all night and keeping her awake.
Okay, do you have any weakness or numbness in your legs?
Yeah, my legs do feel a bit numb, but I thought because the weather's got cold, it might just be that they're a bit cold.
So both legs feel numb?
A bit, yeah.
Okay. I've noticed today you have a walking stick. Is that something you usually carry?
No, just today I was feeling a bit kind of wobbly.
Oh, okay. Yeah. Just today, so you feel a bit unsteady?
Yeah.
Okay. Have you had any problems passing urine?
Well, strangely, I just realised I haven't passed urine since last night.
Oh, okay. And you've been drinking normally?
Yeah.
Because right now it's the afternoon and you've not passed urine since last night?
No.
Oh, okay. Any problems with your bowels?
No.
So I need to ask you a personal question, if you don't mind. Do you have any problems with your erections?
No.
Okay. When you do wipe yourself, when you open your bowels, can you feel yourself wiping?
Yeah, but I have noticed that it's a bit embarrassing.
Second one?
My right testicle is a bit numb.
Your right testicle's numb, okay. And any discharge from the penis at all?
No.
Any eye pain?
No.
And do you have a fever at all?
Well, I haven't taken my temperature, but I don't think so.
Any night sweats at all?
No.
No. Any weight loss?
No.
And does the pain ever move to the upper back?
No.
Okay. In terms of your past medical history, do you suffer from any medical conditions?
Only sciatica And I had my gallstone bladder out about 5 years ago because they found stones in them.
Oh, okay, so you had your gallbladder removed 5 years ago. They found stones. Okay, and you said you've had sciatica. Have you had this investigated before, or how was it diagnosed?
Yeah, they took an X-ray and they said it was degeneration.
Okay. Yeah. Okay. And this is just a routine question, not to be alarmed. Do you have any past medical history of any cancers at all?
No. Okay. I did have a problem with constipation a while ago. And they did one of those stool tests.
Okay.
But they said it came back normal. So.
Okay, so it was negative to that. And are you on any medicine at all?
Yeah, folic acid.
Okay, folic acid. Okay, that's fine. And anything else?
No.
No. Okay, are you allergic to anything?
Yeah, penicillin. And statins don't quite agree with me.
Okay. Anyone in the family unwell with any arthritis or any other problems?
Well, my mother had a knee replacement, and they said she had arthritis, some kind of
osteoarthritis, like the wear and tear.
Yeah.
Okay. Okay. And in terms of your social history, do you smoke?
No.
Do you drink?
Occasionally, I have a drink, but not very often.
Okay. And are you retired at the moment?
Yes, I was an optician. I worked for Boots for 40 years. But I'm glad I'm not working anymore because the technology's changed so much.
Yeah, I can imagine. Yeah, I can imagine. Who's at home with you?
And my wife, Donna.
Your wife, Donna. Okay, perfect. Thank you. And how has this impacted you, your back pain for the last 2 days? How's it impacted your life?
Well, I can't do much. I just kind of sit and watch telly, and my wife says I'm putting it on because I don't want to do anything around the house. But well, it's quite bad.
And what were you hoping I could do for you today?
Well, I was hoping that you'll give me... Well, my wife takes a painkiller called naproxen, which helps her, so it may be that, give me that. And also she has some physio. And I looked online at some physio exercises, which I tried to do, but I couldn't do them. I just couldn't.
Because of the pain? Yeah. Oh, gosh, okay. Just to summarise, and correct me if I'm wrong, you've had a 2-day history of lower back pain, and it radiates it goes down to both legs, all the way down to your ankles. You've also got some numbness in both legs, and you feel unsteady, which is why you've got a walking stick. Your right testicle feels a bit numb on wiping, and you've not passed urine since yesterday. What I would like to do is I'd like to examine the power and the sensation in your arms and your legs. I also need to perform a digital rectal examination. So what it entails is inserting a gloved finger into the back passage. It shouldn't be painful, but it might be uncomfortable and a little bit cold. If you want me to stop at any point, I can, and there'll be a chaperone with me present.
Okay.
Does that sound okay? Marcus, thank you for coming to see me today. Having examined you and listened to your story, I think you may have something called cauda equina syndrome. Have you heard of this before? Okay. It's a syndrome where there is continuous pressure on the lower nerves of the spinal cord, stopping them from working properly. Now, what I need to do is I need to send you in for an urgent MRI scan of the back and get you treated accordingly to ensure that no further damage takes place.
Okay.
I appreciate it's not what you were expecting to hear, but it's good that you've come in, that we've picked it up and get you treated. Okay. Do you have any questions for me?
No.
Okay, no. In order to understand cauda equina, let's revisit some anatomy. Now, if you remember the spinal cord, it runs from the foramen magnum in the skull down to around L1, L2, where it tapers in an area called the conus medullaris, and this is the end of the spinal cord. After this point, it becomes a bunch of spinal nerve roots known as the cauda equina, and it's called this because it looks like a horse's tail. Just to recap, the cauda equina starts at roughly between the L1, L2 vertebrae. And so anything above this level, the nerves are all joined together as a spinal cord. Later on in this video, we will distinguish between spinal cord compression and cauda equina because I've seen lots of students get confused between the two, so keep watching. So what is the function of the cauda equina? Well, it contains the nerve rootlets of the lumbar sacral plexus, and this includes the autonomic fibers controlling bladder, anal, and sexual function. Now, cauda equina syndrome occurs when these nerve roots in the lumbar spine are compressed, disrupting sensation and movement. Cauda equina syndrome is an emergency because it can lead to permanent paralysis, impaired bladder and/or bowel control, and loss of sexual sensation. If you look at the cauda equina's nerves, notice they are already quite close together. So when they do get compressed, they can get anoxic damage within a few days or even hours. And sadly, even with immediate treatment, some patients may not recover complete function. So what can compress these nerves? Well, you can get a central disc prolapse, which is the most common cause. You can get an infection, such as an abscess. You can have cancer. This can be primary or secondary. Trauma and degenerative spondylosis, usually in older patients. Of course, this list is not exhaustive, but I would like you to bear in mind that cauda equina syndrome can affect adults of any age. In terms of signs and symptoms, these can be separated into early and late signs. Early signs include altered saddle sensation. So this is tingling, pins and needles, altered sensation of micturition. You could ask, does it feel normal when you pee? Delay or difficulty opening bowels or initiating micturition. A change in erections or vaginal sensation. Patients might not volunteer this, so you need to not shy away from asking this directly. And back pain, with or without sciatica pain. And bilateral sciatica may be present, but bear in mind that bilateral sciatica is only present in about 50% of cases. Therefore, the absence of bilateral sciatica does not exclude cauda equina syndrome. Just to remind you what sciatica is, it's a pain or altered sensation in the nerve root distribution that generally goes below to the knee, down to the foot. Late signs include saddle anesthesia. Now this is a numb buttock. Incontinence, people go into retention first, because once the bladder has gone atonic, it fills up, then you get overflow incontinence to stop itself rupturing. Severe progressive bilateral neurological deficit in the lower limbs, lower motor neuron signs, and loss of anal tone. So if a patient is developing cauda equina syndrome, but they get surgical treatment early, before they become incontinent, there is a reasonable chance of avoiding the urinary and fecal incontinence, loss of sexual function, and paralysis of the legs. This stage is called cauda equina syndrome incomplete. Once the patient develops urinary retention and overflow incontinence, the outcome is much worse. I think of cauda equina syndrome as a continuum and not a discrete illness. So early on, you get symptoms, and as that compression continues and that anoxic damage continues, you will get worsening symptoms. So there will be that change, and the longer you leave it, the more signs you will get. So of course, the earlier you pick up cauda equina syndrome, the better the outcome with surgical intervention. Cauda equina syndrome is diagnosed when there are both clinical features of cauda equina and evidence of compression on the MRI. So it's a clinical and radiological diagnosis. It's a neurosurgical emergency, so you really need to get that MRI ASAP, and the treatment is surgical decompression. So fairly recently, I was overrunning in a very busy clinic, and I saw a gentleman who suffers with chronic low back pain. And he was just asking for an alternative analgesia, as his current one was giving him really bad gastritis. And as he was rushing out the door, I thought I should just recap the red flags, expecting them all to be negative. And he very quietly admitted to me that he had wet himself that day. I sent him in for imaging urgently, and his MRI did in fact show a disc bulge with cauda equina compression. Now, What this case taught me is that never to make assumptions. Don't assume that the patient will volunteer things, especially when they perceive it as something embarrassing. Ask specifically about each and every red flag. I've seen a lot of emphasis on anal tone on rectal examination, but evidence has shown that assessment of anal tone is a poor predictor of Cauda equina syndrome. And honestly speaking, it's also very subjective and it varies with age anyway. I think the key thing to note is not to be reassured with the presence of anal tone, as that doesn't rule out Cauda equina syndrome. But the absence of anal tone should make you think, gosh, I really need to get imaging immediately. When I was preparing this talk, the thing that really struck me is that no single symptom or sign is pathognomic. In addition to this, the clinical features might be subtle, especially disturbance of saddle sensation and urinary function. A large proportion of the older adult population already have urinary symptoms anyway, sometimes caused by the drugs that we prescribe, like opiates and anticholinergics and gabapentin, etc. And even if you have back pain caused by muscular sprain, that pain itself might cause an involuntary inhibition of micturition, or they might struggle to get in a correct position and relax their pelvic floor muscles. So given the high prevalence of low back pain and urinary symptoms, it's quite difficult to tease out Cauda equina syndrome. Also, we can easily miss Cauda equina syndrome because it's rare, whereas non-specific muscular skeletal back pain is what we mainly see. Watch this clip demonstrating how I would approach this. I understand you've been suffering from back pain for a long time, and there's lots of causes of back pain, but I think your type is due to a muscular back pain. My advice to you would be to continue being active and to mobilize, because if you do have prolonged bed rest, the muscles will stiffen and it'll exacerbate your pain. In terms of painkillers, I can give you something called naproxen, which is an anti-inflammatory. This can cause heartburn, so I can give you some lansoprazole as well to protect the stomach. Would you like to be referred to physiotherapy?
Yeah.
They can give you some exercises to help strengthen those back muscles. On a very important note, if you do develop any symptoms such as not being able to pass urine, or having any accidents with your bladder or bowels, or any weakness or numbness in your legs, or any numbness around the genitals, you must see a healthcare professional that day. I know it's a lot to take in, so what I'm going to do is I'm going to print off a leaflet for you to let you know which symptoms to look out for.
Okay.
Thank you very much. Do you have any questions for me?
No.
Okay, thank you. So most cases of back pain are fairly innocuous, usually caused by poor posture or muscle sprain, and it often gets better on its own if the patient remains active. And it's called non-specific or mechanical back pain. Did you see how I gave safety netting advice? It's not sufficient to say, if you're not getting any better, please come back. That doesn't count as safety netting advice. Ideally, the advice should really be given in written form too, and there are plenty of safety netting cards available on the internet. So in conclusion, although Cauda equina syndrome is rare, you need to have a high index of suspicion when assessing back pain. I want to very briefly touch on spinal cord compression, just because I've seen students get confused between the two. So the same sort of idea applies. It's compression, and things that cause Cauda equina syndrome can also cause spinal cord compression, but it just happens at a much higher level. Having said that, the most common cause of spinal cord compression worldwide is actually trauma from falls. Because spinal cord compression happens higher up, the signs and symptoms are different from Cauda equina syndrome. If you think back to the anatomy, the end of the spinal cord is known as the conus medullaris. Pathology above this, you will get upper motor neuron signs, and anything below this, you will get lower motor neuron signs. So the way I always remember it is that in lower motor neuron, things tend to go down. Reduced tone, reduced reflexes, down-going planters. Upper motor neuron, things tend to go up. Increased tone, brisk reflexes, upgoing planters. Let me know in the comments if you'd like me to make another video on the differentials of back pain. If you like this video, check out our other content on breathlessness and taking a falls history. We have more content to be released soon. Hit subscribe to keep updated. I hope you found this video useful. Thanks for watching, and I'll see you in the next video.